Hello everyone, we're on the campus of Southwestern Oklahoma State University where an exciting event is getting ready to take place tomorrow. And so I'm visiting here with Randy Curry with the pharmacy school here at Southwestern. Tell us your title. What exactly is your title?
I am Rural Health Coordinator for Southwestern College of Pharmacy Rural Health Center here on campus, and we work statewide doing such as this and seeing what we can help.
Very good, very good. So we're here socially distanced without masks so that you can fully understand us today. And Randy's going to take you kind of on a little tour of how the process will work in administering the vaccine. So Randy, please take us on a tour.
Okay, we will be administering vaccine tomorrow 9 to 4. You must have an appointment. You will show up the west doors of the Pioneer Cellular Event Center. Come in these doors right here. A police officer will check your list, check your appointment, allow you to come in. Nobody will be admitted unless they do have an appointment, except the workers. You will come in and actually come over and take a seat to the right, which will be the waiting area. And at that time, people at your time, say 2 o'clock, people will hold up a sign and you will come to one of the available inductees right here that will be actually process all of your information. And that takes 5, maybe 10 minutes to get all the required information and go over several questions. They ask you health questions and stuff, make sure there's not any problem. Then you will have a person take you to one of the seats over here, which you have a pharmacist, a pharmacy intern, or a nurse actually sitting there, and will ask you some similar questions and administer the vaccine at that time. Once that is completed, we will take you on around the corner, and there is a waiting area where if you've never had any type of side effects with vaccines, you will wait 15 minutes. If there's any question of having a possible adverse reaction in the past in your history, you will be required to wait 30 minutes. And you will be monitored make sure there's no issues developed from the vaccine. Once your time is complete, you will exit through the north doors, and we will process the rest of the paperwork for the state here. And we will have health department personnel on scene, pharmacy faculty, and also nursing faculty.
Very good, very good. So the characteristics of the people who would be coming in tomorrow, Friday, 65 and older.
Right.
Okay, any other categories, the finishing healthcare providers?
There will be, if there are some that have made an appointment as far as healthcare providers, frontline workers will have access. That may hinge a little bit on vaccine availability.
Okay.
On that, and that's a health department question there. We can check that out as we go through.
Sure. Well, I have signed up on the portal that opened up today, actually,
right.
And it was very easy and convenient to do. And I was kind of impressed with it in that, you get all the information in, and then within minutes, I had an email saying, when your next available time slot is open, we'll send you information to come up. So I was impressed. It looks like it's going to work well. Does that help you all that people have done that ahead of time?
That's a big help. That's been part of the problem until it was up. People were having trouble getting in to set appointments and stuff. So this is going to prioritize the patients, if they're in what phase they're in because of their, if they're over 65, it's going to bump them up the scale, and if they're 50, it's going to maybe put them in a different tier. So it's going to definitely, I think, help organize and structure things, especially on the health department side, and help the flow rate.
Sure. So this is the first time in the Pioneer Cellular Event Center, but you have been doing some of these clinics of sorts in other towns?
Yes, we worked the health department clinic in Clinton on Monday, and we did around 300 immunizations there, and also we did around 300 at Taloga yesterday.
Okay. Very good. So for us who don't understand it, how does this fit into what you do traditionally with rural healthcare?
I work with rural pharmacies, rural hospitals across the state, helping implement immunizations, other healthcare services that they may not be doing.
Okay. Very good. So this naturally seemed a progression. So we're fortunate, really, that this is available in Western Oklahoma through the university,
Right.
and to have this kind of program in place.
Right, and we're very fortunate too. The administration was very supportive of opening up facilities. People have been calling to volunteer. A lot of faculty, a lot of outside people. So we've got plenty of help.
Good. No need any more volunteers.
Well, we may as
Okay.
time goes on.
Let us know. Let us
We
know.
will. We will.
We'll tell everybody.
Okay, we will.
That they can contact the right office for that.
Yeah.
Very good. Is there anything else we need to know about tomorrow? So, again, I don't know if we mentioned, so Friday is the first one in this location, but you'll be doing it for a series of Fridays. You don't know exactly how many, but
We've anticipating booking out about 8 weeks on Fridays. So until the numbers start to decrease, then we'll start to scale down.
okay.
Back on services on that. We're just playing that by ear a little bit. Just another tidbit that people might be interested. The administration helped us get set up. We have ultra-core storage on campus in a secure area on backup power. So we're able to house both vaccines in a safe manner.
Okay, very good. So again, I don't know the answer to this, so maybe you can help me in terms of other locations. Can they still get the vaccine, perhaps at the health department?
I'm not sure if they're administering any at the health department for the public yet.
Okay.
But yes, they can. They have said that we had people at Tologa come in from Arcadia. They had open spots, so they let cross counties come into some of these other areas.
Right.
Right now, Weatherford is booked tight. So
Randy, if you would, take us on the follow-through on the process once somebody arrives.
Okay. Phil, you would come in, you would, like I said, sit down here. We would fill out the paperwork. We would have, once that's completed, we would actually have you come over this way, and we would follow me over here to one of the injection sites. And we would actually have you sit down here, and I would prep all the questions again. I would have my syringe drawn up and prep you to give you the injection, sign off on the paperwork, everything looks good. I would take you to the waiting area right around the corner, and you would wait your 15 minutes.
Okay, very good. Well, how nice is it to have this big facility
this is
for
awesome.
this?
This is awesome.
I mean, it's laid out perfectly
It's
for this.
perfect.
Plenty of parking, access,
Right,
easy to
right.
find. So
Right.
it's a perfect location for
Yeah,
this.
it's ideal for it, and come a little bit early for your appointment. We'll let you in, and we'll start processing just as quick as possible. So
And tell us the times again for
it will
Friday.
be starting at 9 o'clock in the morning until 4 p.m. tomorrow,
Perfect. And then again the following Friday.
and the following Friday.
Perfect, perfect. Well, thank you very much.
Thank you.
We appreciate it.
Thank you.
And
We're glad
everything
to.
you and your volunteers and the students and faculty it's fantastic to have that. Just another benefit of living in Weatherford.
That's right. I'm just so amazed at the volunteerism in the community. The students are eager and excited to get to help make a difference.
Yeah.
So
It's part of history.
it is.
I mean, they're
really.
part of history
Yeah.
by doing that.
You know, there's no other time in their lifetime they'll hopefully
Right,
not get
right.
to do something like this.
That's right. Let's hope so.
I hope not. So,
Yeah. Well, thank you again.
thank you.
Sure.